Thank you, Mr. Williams, and good afternoon to everyone. This afternoon, I will share with you the Health Emergency Operating Committee's Situation Report for today, Friday, May the 28th. Within the last 12 hours, the Ministry of Health received positive results for 4 additional cases. These four individuals are all nationals. These cases are linked to cases we reported recently. So at present, the Federation would have announced 68 confirmed cases, 54 cases from St. Kitts, 14 cases from Nevis. At present, we have 23 active cases. So the Ministry of Health, we are monitoring 23 active cases. 45 cases are fully recovered. Ladies and gentlemen, the virus is back. It has been reintroduced into our federation. We are presently trying our very best to contain this cluster of COVID-19 cases. So at present, we have 23 active cases, and as you realize, this cluster is gradually expanding. Our aim is to flatten the curve and keep the total number of impacted individuals to its lowest. And we are doing this through contact tracing. Those cases that are identified are placed in isolation so that they do not spread the disease. Their contacts are placed in quarantine to observe for the onset of the disease. We are testing all contacts, and we are also conducting targeted testing. What is contact tracing? It's the process by which we identify, evaluate, and manage persons who have been exposed to COVID-19, persons who interacted closely with persons who have been identified as positive. This is a scientific process, and it has been proven to break the chains of transmission of the virus. The Ministry of Health continues its robust contact tracing. We started this last Wednesday, and again, the aim is to identify, quarantine, isolate, and test all possible contacts of recent cases. Last weekend, Saturday and Sunday, we went into the Sandy Point Primary School. A total of 128 students were tested. By Monday, we went to the Charles E. Mills Secondary School. A total of approximately 128 students were tested. These 256 students, along with their households, have been asked to self-quarantine. 256 students and households have been asked to self-quarantine. Thank you. By Wednesday of this week, the Ministry of Health, we went to the Washington Archibald High School, the Bastia High School, the Seventh-day Adventist Primary School, and the Tyrrell Williams Primary School. A total of 441 students were tested. Now, at these 4 institutions, the students, and only the students, have been asked to self-quarantine. The recommendations we've made to the household is as follows. The household members are asked to adhere strictly to the COVID-19 prevention and control measures. So we are asking the parents, the guardians, the other relatives who live in the house with these students to wear a face mask at all times. And if and when you're interacting with the child, make sure to sanitize your hands before you do so and after doing so. These measures will help to prevent the spread amongst the household members. So, ladies and gentlemen, over the past few days, since we've been trying to contain this cluster of cases, approximately 760 760 persons have been touched. 63 of these individuals are in isolation and quarantine at a certified hotel or a government certified facility. So the 23 active cases are included in the 63. 697 persons have been asked to self-quarantine. So a total of 760 persons have been impacted by our contact tracing process. The Ministry of Health continues with its testing. So we are testing contacts. We are also conducting targeted testing, those individuals who may be associated with contacts. Just yesterday alone, that's Thursday, May 27th, we processed 570 samples, and the results all returned negative. The contact tracing process continues until we would have contained this cluster of cases. We continue in terms of administering the AstraZeneca Oxford vaccine. Please note that once you are fully vaccinated, you will enjoy an 83% risk reduction in terms of your ability to contract COVID. So in other words, once you are fully vaccinated, your risk of picking up the disease is extremely low. Your risk of transmitting the disease is also reduced. Your risk of becoming moderately or severely ill is significantly reduced, and so is your risk of dying. Dr. Wilkinson would have explained the dosing interval, and so based on the instructions from the manufacturer, and we also need to note that this vaccine has been approved by the WHO, and so WHO would have approved the dosing interval. So the two doses can either be given 1 month apart, or as the interval can be as long as 12 weeks or 3 months. Data at the end of work day yesterday. So up to yesterday evening, we would have administered a total of 25,347 vaccine doses, 19,167 SIN kits, 6,180 in Nevis. In other words, 56% of the target population has been covered with the first dose already, and as much as 21% of the target population has been covered with the second dose. And so this is very good, given the fact that we started our program on the 22nd of February. Now, last year, March, when we announced our first case, we went into a lockdown. This year, now we are impacted with this second wave of infections. We have to reflect on the lessons that we have learned. Now, COVID-19 has left a huge impact on us in terms of economically, socially, psychologically. It has impacted our children. And even with this second wave, it's impacting our children even more. However, the results we get or we continue to receive will dictate the way forward. Recently, these statutory rules and orders have been announced. So at present, our schools are closed for 2 weeks. At present, there is restriction in terms of public transportation. Superintendent Cromwell Henry will speak more to this. There are restrictions in terms of contact sports. There are restrictions in terms of movement. So at nights, there's a nightly curfew between 11 p.m. and 5 a.m. daily. And there is a restriction on inbound travelers, inbound regional and international travelers, who are now expected to submit proof of full vaccination as of tomorrow, May 29. Please note citizens and residents are exempted. I also want you to note that all inbound passengers must still submit results of a negative RT-PCR test done within 72 hours of travel. We continue to adhere to our usual and our regular health and travel protocols, whereby upon entry into the Federation, All inbound passengers are screened at our health station, and it's only those individuals whose test is not up to standard would we test on arrival. All inbound passengers automatically go into quarantine, and they are tested while in quarantine and at the end of their quarantine period. So we do not test all inbound passengers upon entry. However, all inbound passengers go into quarantine. They are tested while in quarantine and at the end of their quarantine period. And we've been using these protocols for 6 months, and it has been serving us quite well. Please remember the essential public health measures of wearing your face mask. As I said before, this has been reintroduced into our federation. It's a microscopic organism. You cannot see it. And so in order to protect yourself from it, you must wear your face mask. Once you leave home, at the beginning of every day, once you're out in the public domain, you must wear your face mask to protect yourself from this small microscopic organism. Maintain good hand hygiene and make sure you are adequately distanced from individuals as you go about your daily activities. Avoid crowds and events. Protect yourself. Do not wait. Vaccinate. I thank you.